Here we are today with Gail and Esther Thornberg. It's a pleasure to have you, and Tom Oliver, thank you for being here today. My name is Greg Westfall, and we would just like to thank you for allowing us to videotape you with your experience with the NeuroCare 1000 XP and the CES unit that we see here. We've got a couple electrodes out. How have you, what application have you been using the NeuroCare for, Gail? Can you share that with us? Esther, would you rather share that with us?
Actually, I've been using the pills or medicine that I get from the VA hospital.
That's what the medication in the past.
In the past.
But he's using the both of these pieces of equipment. The
CEL, the cranial unit.
Yes, right.
This
and
one here is
that one.
This unit is for the neuromuscular electrical stimulation.
Right.
What application do you use the NeuroCare 1000 XP for?
We've actually hooked that up to his one leg, which is smaller than the other leg. And he's had a lot of itching, a lot of irritation.
Circulatory problems?
Right, right.
Itching is usually an indication. Tom, what applications are they being treated for?
Right now we're trying to balance out the lower musculature in his legs for stability and lack of shaking so that he's able to get around better. We found one leg was actually smaller in diameter than the other, which was disuse atrophy.
Disuse atrophy.
So now we're going to build that muscle up.
And is that from a certain disease or challenge? What's the problem?
Yes, he has Parkinson's disease and has had the disease for about 10 years.
For about 10 years.
So we're Johnny-come-lately on this. We'll be working both legs after the first week. We're 3 treatments now into the treatment program. After 1 week, we'll go over to both legs, and the following week we'll probably be concentrating on the upper body as well as the lower body, the arms, hands, and that area. Then he's also doing the cranial stimulation, which is balancing out the firing of the thalamus to the cerebral cortex. This helps control the extreme shaking. From our first treatment, even with the medication, he had tremors and shaking, but the first treatment had really stopped everything, and then he's kind of leveled out, and between the medication and the treatments, looking at him now, he's 100% better than he was the other day when I first met him. But I think an important part to have on there is that the treatments are helping his medication begin work a lot faster. Within 5 minutes, was it, Gail? You're starting to get a response from the medication.
That's right.
And normally it's been 15 or more minutes before the medication would kick in.
Sometimes as much as an hour.
Yeah.
So, Esther, you've seen an effect on Gail. The medications kick in better. Do you think, that, Tom, that's from better circulation?
Circulation, yeah.
Okay. Now, these medications are for Parkinson.
That is
to
correct.
Control the shaking.
That's correct.
Now,
Esther, have you noticed some significant reduction in the shaking from Parkinson?
Yes, I have. He was concerned because he was still had tremors last night, and yet I was holding his hand, and the tremors weren't as violent. Usually when he's coming off of the medication, in other words, the downtime, the off time, the tremors would be more pronounced, and they were just more of a much lower pronounced tremor.
Now, if you're seeing, had he been on medication for tremors for a long time
He's
before?
been on medication for 10 years, and in fact the medication had gotten to the point where his off time was more than his on time, and so they added another medication to the medication he was taking. He's on Cinemet, which is a carbidopa-levodopa, and they added Mirapax to it, which was used to speed through the carbidopa-levodopa. They didn't increase the carbidopa-levodopa, but just added the Mirapax. Well, the Mirapax has side effects that are just incredible. Depression, suspiciousness, irritability. It just goes on and on. And so then they have to give you a tranquilizer, and then they give you pills for the suspiciousness, and
Sure.
it's just an ongoing thing. However, we have cut out the white pill, the Mirapex, now totally, which makes him a much happier man.
What do you credit being able to cut out that pill?
Well, one of the things, it's twofold. We attended a Parkinson's conference down in Eugene, and a man who had been involved with Parkinson's since the day carbidopa-levodopa had been introduced to aid Parkinson's. He said that if you're having difficulty with the tremors and with sleeping and all that, you just need to increase the carbidopa-levodopa. And before they thought that, no, we can't do that because you're going to need it later and you'd build up a resistance to it, and that is bunk. So we did increase his carbidopa-levodopa to 3 tablets instead of 2, and we then started eliminating the white pill a little at a time, breaking it in half, and then, that sort of thing, because you just don't want to stop a medication immediately. But he was still having some difficulty with the carbidopa-levodopa kicking in, but with this machine, with this right here, as he said, it started being effective within 5 minutes to 10 minutes, and that's just incredible.
Now this, Tom, what do you think's happening with this small CES unit that he uses on his earlobes to help the drug circulate better to the brain?
What we know by clinical evidence, and really lots of clinical studies now, we're not the only ones working on this project, but we know that it is balancing out the activity of the thalamus and the signals going to the cerebral cortex, so that the thought structures are better, the patient then is more relaxed, and increasing the blood circulation because of being relaxed instead of stressed, causing capillary constriction. So as we get capillary dilation, we increase the blood flow.
Esther, you mentioned that there had been some struggle. One of the side effects that the drugs talk about in their product insert is depression and other things like that.
Right.
Have you seen an effect on the depression with this device?
Absolutely, absolutely.
A reduction of the depression?
Almost non-existent now, and that was a constant thing that we have lived with for 5 years. That has, I see a lighter expression on his face.
The old Gale's return.
The old Gale's coming back. Yes.
I might say also that I just took my medicine at 2 o'clock or thereabouts, and within a few minutes or seconds, or whatever you want to call it, I leveled out. I wasn't shaking.
Interesting.
And I felt better.
So you had the shaking. Now you've mentioned some tweaking, some titration of the drugs to. Some people might say, well, the effectiveness might have nothing to do with neurocare. It might all be by the adjustment of the drugs that you've made.
No.
How would you respond to that?
No, absolutely not, because we've been adjusting drugs for couple years, I guess, trying to find the best level. And in fact, at the Portland VA, Dr. Campbell said, Esther, you got to just experiment around with the drugs and see what works best for Gale. And so that's what we've done.
So experimenting around with the drugs in your case included getting a doctor's prescription for this unit and allowing yourself to work with the neuromuscular re-education, the electrical stimulation unit. Where do you hook up this unit on his body with these electrodes here?
Okay, at this point, right now, just starting out, we're using it on his right leg.
The right leg that's atrophied.
Yes.
Do you have him do exercises do you have it straighten his leg and then have him work against it and resist against it?
No, he just sits there relaxed and the machine does it.
And the toes go.
Yeah, toes bend
It
down.
makes the toes work, so you're getting muscle use
Oh, yeah.
out of that leg that's atrophied because of disuse atrophy,
Yes.
as Tom described. And
I can feel it up front of my leg and in the back part of my leg.
now you mentioned some itching with the leg, and that's a sign of circulatory issues.
I did not know that. I
Yeah.
did not know that until Tom told us that.
Have you seen a reduction in that itching?
Yes, you don't have the itching that you had. I mean, it would absolutely drive him crazy at times. And we've tried all sorts of creams and lotions and everything, and nothing would.
Sure, because you're working from the external out,
Right.
and this is a
It's-
problem that needs to be resolved from the inside in. Because as you don't use it, you start to lose it. The
That's
muscles
exactly
atrophy.
right.
We've seen stroke patients that we've been able to increase the girth of their thighs by 10 inches
Wow,
over a 6 to
that's
8 week course of
incredible.
therapy.
Greg, an interesting point Ms. Thornberg had mentioned to me yesterday, right after the first treatment, Gail had gone out into his shop and had been doing some woodwork, and you were out there, I understand, quite a bit longer than you would normally, and that was just one treatment.
Totally missed a dosage of medication. I went, you didn't take your meds. He said I didn't need them.
Interesting.
So that's to me, that's awesome. A little bit of history. My grandmother had Parkinson's, and I grew up with Parkinson's. And that was before they had any medication, any kind of treatment. The only thing they knew to do for Parkinson's back then was to give them vitamin B shots, and it didn't work. So I saw what Parkinson's does to the body. By the time she died, the only thing that she could move were her eyes. And so when Gail was diagnosed with Parkinson's, I was just devastated,
Sure.
really.
You've seen the
because
worst of
I've
it.
seen the worst of it. My cousin, who is a doctor down in L.A., called me and said, Esther, you're not going to see with Gail what we saw with grandmother because of the, progress that they've made. But still, that wasn't very comforting to me when, I just didn't see that medication alone was doing it.
Esther, would you say that NeuroCare has improved the quality of life for your family?
Well, I think it's given us hope that we're going to have quite a few more years together. We have longevity in our genes, and so this is going to let us have a higher quality of life.
So that hope is based on the results you've seen.
The results I've
It's
seen.
not just a hope based on a promise of
No.
something you haven't seen delivered.
No.
Would you
Because
say
they
that
promised a lot of things in the past.
in the past 10 years?
Right.
Have you seen delivery on the promises with
Yes.
this, with NeuroCare?
Yes.
I think a nice statement that I had just the other day, Gail and his physician have been golfing partners and associates, and the physician said, I'm really in hopes of being back out on the course with him. So the doctor's got hope, too.
So if you improve the quality of life, they appreciate it. But if you get their golf game back, they love you forever.
Yeah, right.
Well, I want to thank you guys so much for taking the
Actually,
time out.
Gail's out cleaning his golf clubs right today. So.
All I say is the good Lord probably led us to you, or you to us, to help us to control what's wrong with me, because that's the only longevity that my mother had was she passed away at 96. My oldest brother's still 90. My dad was killed when I was 5. So we do have a lot of, on our side too, a lot of longevity. We figured this is where we're going to find it.
So if you're going to live a long time, you might as well be functioning as well as you possibly
I
can.
sure would hope, yes.
Yes. Now, Gail, I don't notice any shaking on you at this time.
No.
You look fantastic. Your hands aren't
We can
shaking.
stick around, help me clean out my fish pond. That's what we're going to do next. Anyway, we thank you guys.
Yeah, one of the things that we're going to want to monitor from this video, and that is Gail's voice, because probably into the 3rd or 4th week on treatment, we'll get into the voice strengthening part of the treatment, and we'll notice a very marked change in the strength of his voice and being able to talk.
So today is May 5th, 2010.
Right.
Question. To back what he has to say is my voice has gotten stronger because I could hardly talk a week ago.
No kidding. So you've actually seen an improvement in your communication
Oh,
Yes.
yes.
with Gail.
Right.
So
But we will be concentrating on that. We'll have him back, I am sure, listening to him back to normal.
are you going to take
conversation.
measurements of his thigh as well, or are we going to be able to
As
monitor
we go, we'll be able
return
to
of
do all of
girth?
this.
Would you mind if I come around and take a shot of your thigh there?
Well, it's actually on
It's the lower
Well,
leg.
you
The
know,
lower
just
leg.
tell them on this video here that it's you take it a day at a time.
Take it a day at a time. One of the things that we do appreciate gang,
to the school.
yeah, come on over here, is the fact that you're giving other people who are struggling and who may have lost hope and don't know what to do, you're giving them a hope for an improved quality of life.
And they're both looking better already.
So
Yeah, they are.
both of these legs, it's the leg on the right that has experienced.
Small,
That has increased.
but it's gotten a
Yes.
little bigger.
That
It
has
has gotten
increased.
larger already. It's
So
just the 3 treatments, it's gotten a lot larger.
Did you have any colorization issues? Looks to me like they've improved significantly.
Well, they have.
No, they
Yeah,
were
those-
pretty good other
So
than
those
the scratch marks on the anterior tibialis. And they are better.
Now, I noticed some sock lines here, Tom.
Yes, I was noticing that because we have better circulation now in the right leg.
You've been treating this leg, the right leg.
Now, Friday we'll
There's
be
no
starting,
sock lines on the right leg.
Yeah,
No sock
we'll be
lines.
starting the treatments Friday for both legs.
Okay.
And at that time, those marks will disappear.
So this pitting that we see on the right side, on the left side, doesn't exist as bad on the other side.
It did, and it's still there. If you'll notice, there's a minor amount, but the left leg was like this on the right leg, and this, if you'll notice, I can
If you push
press
in
here,
for 5 seconds.
is a gross edema at that point. But that'll all go away once we start the treatment there, and then the leg size will be.
See, look at
equal
the
on
dent
both sides.
still there.
Yes.
The dent's still there. So we got pitting here.
Yes, that's about a stage 4 pitted.
Yeah. So I noticed he's lost his hair down here.
But something else that I'd like you to notice, if you can pick it up, we have none of the shaking in the right leg, and look at the toes of the left leg, they are shaking. And we have not been doing the treatment on the left leg at all.
That's very interesting. So the leg that was worse is now becoming the best.
Yes. And that's our guideline. Friday we'll make the change and do them both.
Gail, thank you so much for your time.
Okay, we appreciate helping you out.
Thank you, sir.
Talk to you later.
Talk to you. Well, we'll pick up this recording in a few
About a
days, or
month.
maybe in a month or so.
Okay.
We'll see how you're doing, and we'll especially be interested in that pitting and how it improves on that leg. Let me just note that we do see some shaking in this left leg that we don't see in the right leg. Thank you, Gail.